everybody would benefit from tongue exercises. What John Mew and Mike Mew have done actually is brilliant. But there are a lot of people out there that have issues, especially more and more now because of technology. The biggest issue actually is the fact that the head is moved forward.
You've probably seen a lot of mewing results online, right? You may be asking yourself can I benefit from this? Well, in this video, Dr. Estrabillo and I are going to talk about the types of people who can see results from mewing, and then the other group who may need to seek professional help or do something in addition to just mewing or tongue exercises. By the way, if you're new to this channel, my name's Ryan, and this channel, Best Face Forward, is about showing you how to improve your looks and your health by improving things such as your airway and your posture and all that good stuff. For the purposes of this video, we've divided people into two groups. One is the group who can see results from just mewing, and that's most of the people that you see online who are getting before and after results from mewing. The second group of people is going to be those who should probably seek some kind of professional help, have some other underlying postural or health issue that is preventing them from seeing results from mewing. What I'm going to do now is break down these two groups and then show you how to identify which one you probably belong in. I just want to note that this is just a general guideline for you to follow. If you really want to know the proper protocol and treatment that you should get, definitely seek professional help. Now, the first group, again, is those who can benefit from just mewing. To be honest with you guys, most of the results that you see online are people who belong in this group. The people in this group, they essentially have no real big underlying postural issue, meaning that their tongue and their body posture is already pretty good. Their airway is pretty good and patent. They breathe through their nose. They really don't have much forward head posture or other postural issues. They have pretty good jaw lines as it is. Also probably have a fairly wide upper palate with plenty of room for their tongue. So by just mewing, this group is able to see results, which is great. If you belong to this group, you should know that you can probably see results just from mewing or pushing your tongue on the roof of your mouth. Or group two. This is where things get a little bit tricky, guys. Honest, I was from group two. Group two is the people who have all or some of the following underlying postural issues. The first is forward head posture. You can notice this if you see that from the side, you need to take a photo, your ear is in front of your shoulder and that your ear is rotated backwards, indicating that because you're looking down, your head has to tilt up. The next one is going to be a recessed chin, meaning that your mandible is further back than your upper palate. Next is a restricted airway. Generally, we're talking about mouth breathers or people who have trouble breathing because their tongue is pushed back into their airway, has less space in their mouth. So if you are in this group, just keeping your lips closed, keeping your tongue on the roof of your mouth is going to benefit you to some degree. However, you may need to do more than that to solve the underlying problems, and this is where you may need to seek professional help, like I am right now from Dr. Estrabillo. And it's just a little bit more complicated than just pushing your tongue on the roof of your mouth. So how do you know if you're in group 1 or group 2? Well, now I'm going to show you a clip of Dr. Estrabillo talking about how to identify if you're in this group and then what to do in order to seek treatment if you are.
Now, you may ask this question, how do I know that I need this kind of treatment, like Ryan? So the way I look at it, it's all about having a good patent airway. I mean that you could breathe properly. Having a good posture. So if you are snoring and you look at yourself from the side, you have a forward head posture, or your head is rotated and you can see that you have a slant in your forehead. Okay? Those are telltale signs that you could use some help. Everybody would benefit from tongue exercises.
Yeah.
There's no question.
Mm-hmm.
What John Mew and Mike Mew have done actually is brilliant. Okay? But there are a lot of people out there that have issues, especially more and more now because of technology. The biggest issue actually is the fact that the head is moved forward.
Yeah.
Forward head posture is Like I go to a mall, I go everywhere in public places and I see them.
Me too. For a quick summary, what do they need to do?
Well, you need to adjust your posture.
Yeah.
You may have to expand your maxilla and the mandible to create more space.
And we're gonna make videos on that about how to know if you need to expand your palate or not.
Right. And the other thing too is if you feel that your palate is so high, that's a sign that you already are a mouth breather. Okay? So people that are mouth breathing, people that are snoring, people with forward head posture, these are the kind of things that tongue exercises alone, although will help you, it's not enough or sufficient to actually enable you to get the result that you potentially are looking for.
Right. Now, the good news is, whether you're in group 1 or 2, whether you're 15 or 50, whether you're a man or a woman, you can make improvements. As you may have seen in my last video, Dr. Estrabillo is going to be treating patients online. Currently, there are a lot of people on the list. We've gotten a lot of feedback from the last video, which is great. So we're not entirely sure when he will be able to treat you. However, send me an email and we will put you on the list and we will try our best to help you. Thank you guys for watching this video. I hope you got some value out of it. Please like this video and subscribe to this channel, and I'll see you in the next video.